organize refined measures and avoid extreme measures or arbitrary addition of control measures. We advise the general public to have a good personal protection, be active in getting vaccinated, in particular among the elderly as of 27th. Across the country, we have inoculated more than 3.3 billion doses. 1.2 billion plus people have completed full course vaccination. Today, we will focus on refine and solidify our measures in the COVID-19 control. We have with us Deputy Director of Emergency Office of the Ministry of Transportation, Mr. Zhou Ming, DDG Li Xiaoyong from the Market Supervision Department of Ministry of Culture and Tourism, DDG Wu Liangyou from the Disease Control Bureau of National Health Commission, and DG Guo Yanhong from the Health Policy and Hospital Management of NHC, and Deputy Director of the Passenger Transportation Department of the State Railway Group, Mr. Zhu Wenzhong. They will jointly take your questions. Now the floor is open for questions. Please identify yourself before you ask questions. With the People's Daily, what is the general situation of the pandemic evolution in our country at present? I'd like to invite Mr. Wu Liangyou to take the question. Thank you for your question. Since the beginning of April, across 31 provinces, autonomous regions, and municipalities, and Xinjiang Production and Construction Corp, cumulatively reported domestic cases numbered 553,251, rippling into all provinces apart from Tibet. In general, the evolution has been featured by the following features. First, there has been multiple sporadic outbreaks in April in 31 provinces. 261 cities and localities have reported local cases. The number of the reported cases have been slightly decreased from March, but still the overall number is at a high level. Second feature is the coexistence of scale outbreak and sporadic cases, in particular in the city of Shanghai and Jilin province. The reported cases from these two places account for 95% of the country. Apart from Tibet, there were some sporadic cases reported from Chongqing and Ningxia. However, in other provinces, there were cluster cases. Third feature is the complicated situation with multiple outbreaks and multiple chains of transmissions. This is true in many provinces. With the cases spilled over from other provinces, there are also cases with sources unknown, adding to the complicated and arduous task of control. At present, the pandemic response has been active and effective in Hebei, Jiangsu, Zhejiang, Liaoning, Anhui, Jiangxi, and Beijing. In Jilin province, the pandemic has been tailing off, and in the city of Jilin, it is already in the stage of clearing the cases, even on quarantine places. And in the city of Changchun, case clearing has moved into the controlled areas. In the city of Shanghai, there is a substantial decrease. However, there is still the risk of overspilling, and there is an arduous task for controlling the situation in Shanghai. Soon we will have the May Day holiday. The country is still faced with the increasing pressure of imported cases. During the May Day holiday, the Interagency Task Force of the State Council will guide localities to refine and solidify our control measures, strengthen the orderly and safe movement of people, minimize social gathering, improve the testing and early warning and monitoring so as to prevent the risk brought about by greater people movement or gathering activities. with the Hong Kong China News Review, with the experiences accumulated from the past 2 years. Are these experiences equally effective on the treatment of Omicron severe cases? Madam Guo Yanhong is taking the question. It's fair to say that the treatment experiences accumulated from the previous 2 years have been proven effective in treating the infection of Omicron, in particular, in light of the treatment practices in the past 2 years and the specific feature of Omicron variant. We've issued the 9th version of diagnostic and treatment protocol. We've stepped up training in health institutions and for health professionals to guide clinical treatment. First, we have tried to ensure standardization and homologous quality for treatment. For severe cases, we've been following the 9th version of the diagnostic and treatment protocol. We admit these patients into the ICU wards of designated hospitals, and we've provided them with respiratory support, prone position, ventilation to improve the sets. We've also stepped up the antiviral treatment, immunological treatment. We've intervened early to combine the treatment with TCM. We've stepped up clinical nursing and nutrition support to ensure homologous quality and standardized treatment. Second, we've stepped up that treatment must be adopted at an early stage. For mild cases or moderate cases, we ensure targeted treatment and the case progression monitoring, in particular the patients with a higher risk. Monitoring must be guaranteed so as to identify the progression trend at an early stage and intervene at an early date. Third, while we treat COVID-19, we are also active in providing treatment to underlying diseases. In particular, for patients with underlying diseases, we have been upholding the protocol of one targeted measure for one patient. We have set up a multi-sectoral and multidisciplinary treatment to provide refined management to facilitate the all-around rehabilitation of the patient. To better facilitate medical treatment once there is any outbreak, we select the top-notch experts team to send to the places in the past 2 years. It's fair to say in the treatment of COVID-19, in particular in the treatment of severe cases, we have trained great number of experts with rich experiences. So whenever there is major cases in certain localities, this national team of experts will be dispatched to the locality to form a panel team with the local experts, and these expertise will have the consultation treatment for severe cases. Besides, we have been following the full pooling together principle by pooling patients, pooling experts, pooling resources, and pooling treatment. All the severe patients have been admitted to high-level designated hospitals for treatment. Meanwhile, we've set up the ward patrolling, triage, nursing, discussion, and consultation for severe and difficult critical cases. All these systems have been implemented. We've also set up a list management for severe cases to ensure good quality of treatment and great treatment efficacy.
Now we allow further questions. From CGTN, in recent days, we are seeing sporadic and clustered cases in China. So we want to know whether we can have travel during the Labor Day festival. Thank you for your question. The floor is given to Mr. Li Xiaoyong. Thank you for your question. Ministry of Culture and Tourism implement the spirit of President Xi Jinping and the deployment of State Council and the Party Committee. We stick to the principle of preventing external transmission and domestic rebound. And we are working together to coordinate the work of culture and the tourism industries, and we want to prevent over-relaxed control and excessive control at the same time. First, we require travel agency to implement the third version of the pandemic travel guide and do not organize tour visit to high and medium risk region and do not offer inbound tour visit. And we temporarily stop the cross-provincial tour visit from land border city, and we adopt circuit breaking requirements for cross-border travel operating activities. Second, we strictly uphold the principle of pandemic control during the travel process and during the travel accommodation, catering, and touring, shopping links, and we require the tourists to abide by the basic requirements of the local pandemic control. And we also remind the tourists to be aware of the pandemic situation in the destination and wear your mask and keep your social distancing, and also avoid taking food in closed area, and you can use shared chopsticks. You should not use shared chopsticks, and please use public chopsticks. And when you are suffering from symptoms like fever, please stop your travel as soon as possible and go to the nearby hospitals. Thank you. Now we allow further questions. From China Transportation News, the Labor Day holiday is coming. I want to know the passenger traffic forecast for the holiday, and what is the forecast for road network? And thank you for your question. The floor is given to Mr. Zhou Min. Thank you for your question. The May 1st holiday starts from April 30th to 4th of May. And the holiday is coming, and the people have more willingness to travel. Leisure travel, hometown visit are increasing, so people's mobility will further increase. Our current travel forecast, it is expected that there are three features for the passenger traffic during the holiday. The passenger traffic will reduce significantly as compared to last year. It is expected that the total passenger traffic will reach 100 million, a reduction of 62% as compared to the same period 2021. And we will have a peak momentum, and it is expected that the peak will happen on the first day, reaching 22.5 million, a reduction of 61% as compared to 2021. And also we will have more visit as short distance visit. And because of pandemic control policies, the travel distance of most of the tourists will be shortened as compared to normal periods. As to road network, we forecast the road network will have the following four features. First, the throughput will reduce remarkably, and the total throughput will be 27 million, a reduction of 49%. And the traffic jam will increase as compared to normal business days because of pandemic control regions on toll station, expressway, toll station, and highway. On some of the highways, we will have checking points for pandemic control regions. And because of increased traffic, we will have a traffic jam on some of the roads. The third feature is regional difference. The throughput along the Yangtze River Delta region will reduce significantly, while the throughput in the Big Bay area, Chengdu and Chongqing area will remain high. And also, the traffic will wax and wane. Most of the travel will be short distance travel around the city, and we will have wax and wanes. We suggest the tourists to follow the four recommendations during the May 1st holiday. First, follow closely the pandemic control policy and pay attention to your self-protection. Second, pay attention to the weather condition. Understand the weather condition of the neighboring area and check your car and reduce the travel speed and maintain distance between cars, ensure safety. Third, pay attention to traffic situation. You should try to understand the timely road condition report and traffic jam reports so as to have a staggered visit. Fourth, please pay attention to toll-free policy. The holiday starts from April 30 and on May 4th. And for passenger cars with less than 7 seats, you will enjoy toll-free policy. And a toll-free policy will end when your car leaves the expressway. So when the toll-free period ends, you can choose to leave the expressway, and you should avoid overspeed driving. Thank you. Now we allow for the questions. Thank you. From China radio station. Because of clustered cases and some of the travel requirements of the tourists will change, and some of the people have to cancel their visit. And what are the arrangements for people to cancel their tickets? The floor is given to Mr. Wu Wenzhong. Thank you for your question. And if there are clustered cases, and the local government will adjust the train schedule and stop or reduce the number of trains to pandemic hit region or shorten the train travel distance. And we will adopt temporary measures to avoid the spread of the disease through railway. When a train is stopped, our automatic system 12306 will send a short message to passengers, and we will not charge any fee for turning back the ticket. And the passenger can cancel their ticket through internet or automatic self-service station, and we provide 24-hour ticket return service. Thank you. Now we allow further questions. Thank you. From the paper, we take note, and we are seeing some death cases recently. What are the common features of those death cases? What measures are adopted to reduce severe case and mortality rate? Thank you. The floor is given to Madam Guo Yanhong. Thank you for your question. The recent reported death case has the following features. Most of the death cases are suffered by elderly people and who are of extreme high age, and they have comorbidity, and some of the comorbidity are very severe. This reminds us that when curing the COVID-19, we should pay attention to the basic conditions or comorbidities. Looking at the recent death cases, we should not treat COVID-19 as a general influenza or big influenza. COVID-19 caused severe harm to the public, especially the elderly people with comorbidities. And it will severely affect people's health and the security of their life. So we should implement the prevention policy of the party, and we should implement the health guideline of the party and prevention and reduce infection, prevent infection and reduce infection. For families with elderly people and elderly people care organization, we should prevent the virus to enter the institution or the family. When the pandemic happens, we should let the elderly people stay at home and should have closed-loop management at the elderly people care homes.
To avoid severe cases or death, the elderly should more proactively get vaccinated, wear masks, wash hands frequently, refrain from gathering, and have good personal protection. Going ahead, we will continue to promote the minimization of death cases or severe cases in the following aspects. First, we should pay attention to identification of the high-risk factors for severe cases, intervene early with medical treatment. Early intervention and standardized treatment will help to reduce the possibility of mild cases converting into the severe cases. Second, we should focus on the improvement of designated hospitals. We should select the hospitals with a strong comprehensive capacity and multidisciplinary capacity. We should also improve the specialized treatment capacity of the designated hospitals so that they can co-treat those underlying diseases. Third, we should have the multidisciplinary patrolling of the wards, provide targeted treatment for individual severe cases. Fourth, we should strictly implement the mechanism to discuss the severe and difficult cases and the discussion of the death cases so as to improve treatment quality. Fifth, in the long run, we emphasize the importance of vaccination, in particular vaccination among the elderly. At the same time, this should be carried out in tandem with the research and development of therapeutic drugs.
好，谢谢，请继续。好，先来请左侧区第一排第2位记者。
Thank you. With Xinhua News Agency. How will the Ministry of Transportation do a good job in balancing transportation service and COVID-19 prevention control during the May Day holiday? Mr. Zhou Ming is taking the question to ensure safe, healthy, and convenient transportation of the general public during the May Day holiday. The Ministry of Transportation has issued a policy circular this morning to deploy the service guarantee during the May Day holiday. I'd like to focus on some of our key measures. First, we will refine and solidify control measures. We require the transportation operators to have ventilation disinfection of the stations and transportation vehicles, seriously check the health barcode of passengers and carry out temperature testing and monitoring. We will remind the passengers to wear masks throughout the entire journey and implement the 1 meter social distance line. We will improve the health monitoring and management of the staff working in this industry, improve personal protection, standardize operational procedures. We will enforce more strictly, adopt online and offline measures to step up supervision and inspection of the key links. Second, we will optimize the transportation services provided to passengers. We require the transportation operators to scientifically schedule their cars, vehicles, and buses, focus on the delivery of transportation capacity and emergency rescheduling among key areas to minimize the social gathering. There will be dynamic monitoring over the city public buses, urban rail transits, shorten the spacing among different transportation slots, and minimize the gathering of the passengers. In response to the needs of migrants going back to villages and going back to workplaces after the end of the festival, will optimize the transportation organization, have more frequent buses for these rural migrants, provide rental car services, and provide more convenient and humanistic services to the elderly, the young, the pregnant, and the sick. Third, we will collaborate with the meteorological department to pay special attention to the alarms for extreme weather, urge the transportation operators to be prepared, improve the workforce and material stockpile and reserve, have timely rescheduling of the operation plans. We should focus on the management of some key vehicles and passenger transportation vehicles to and from villages, focus on the enforcement checks at the entry and exit point of the highway, key places, rural areas, so as to crack down on illegal transportation. We will have a 24 o'clock around the clock duty, and we will collect the feedback from the general public and safeguard the legitimate rights and interests of those who work in this sector. Finally, I'd like to take this opportunity to appeal to the general passengers. During the May Day holiday, you should stagger your visits and refrain from going to crowded places. If you have to travel, wear your masks and have good hand hygiene, keep social distancing, have a good personal protection so that we will have a safe holiday.
好，谢谢，请继续提问。好，我们来请右侧区第二排的靠过道第二位记者。
With the CGTN, I also have a question on the May Day holiday. Many have the plan for the holiday. Will increase the people movement, increase the risk of a pandemic. Are there any health tips for the travelers so that they can travel safe and orderly? I'd like to invite Mr. Wu Liangyu to take the question. Thank you for your question. At present, we are faced with the ever-increasing pressure of imported cases. The risk for domestic outbreak is still high. The coexistence of multiple sporadic cases and local cluster cases and the risk of inter-regional impact have added the grimness of the COVID-19 prevention and control, as other colleagues have presented just now. Localities should have a holistic balance between the COVID-19 prevention control and the regular needs of the general public for travel during the holiday. There should be a higher awareness of risk, and the localities should scientifically guide safe and orderly movement of the general public. We advocate the short distance travel or city outskirt travel to minimize the transmission risk. For the general public who want to travel, you are advised to pay special attention to the dynamics of the pandemic and the listing of medium and high risk regions and refrain from visiting those destinations. Learn about the COVID-19 prevention control policies in your destination in advance to your travel. During your travel, have a good health protection, wear masks, have good hand hygiene, refrain from gathering in dining, use separate dishes. If you show symptoms of fever or coughs, you should stop your travel and seek medical services so as to confirm you are not infected, thus preventing our transmission. Let's jointly safeguard the hard-won achievements in COVID-19 prevention control. Thank you. Next question, please.
好，我们来请右侧区第三排第二位。
中新社记者提问。即将到来的五一小长假，记者提问。即将到来的五一小长假，旅客出行可能会有所增加。铁路部门在人力安排方面有哪些如何做好旅客专车？
Are there any measures for the railway department for your transportation capacity arrangement, and how will you control the pandemic?
Now the floor is given to Mr. Zhou Wenzhong. Thank you for your question. Now I want to introduce you the travel schedule for the Labor Day. And in 2022 Labor Day holiday, we will in total have 8 days of increased travel. It is forecasted that in total we will have 32 million passengers. 4 million on a daily basis, and we will have increased short-term travel and short-term hometown visit, short-distance hometown visit. To satisfy the need of people's travel during the holidays, China Railway Group have formulated a differentiated, refined, and high-speed plan for satisfy the needs of the passengers. First, we will refine the schedule on a timely basis. We will follow the pandemic situation on a timely basis, and we will rely on 12306 big data system to make analysis and dynamically adjust the train schedule. Second, we will offer differentiated services. For provinces, cities, and local areas suffering from different situations of the pandemic, we will provide a different supply, and we will provide short-term distance transportation capacity to Pearl River Delta, Chengdu, Chongqing, and the Yunnan, Guizhou area, where the pandemic is of the least influence. Thirdly, we will provide a fast speed adjustment to satisfy emergency requirements, emergency increase of the passenger requirements. We can increase passenger cars as soon as the passenger needs arrive to ensure the safe and orderly travel of tourists. We stick to the general principle of preventing import of foreign cases and preventing domestic rebound, and we insist on the dynamic zero COVID policy, and we try to control the passenger load within the cars, and we measure the temperature and also encourage better ventilation and disinfection. We have face wiping services and also other non-contact services like ordering food by scanning the VR code, and also we strengthen onboarding and boarding services to passengers. And safe travel are the common aspiration of Railway Ministry and the general passengers. And I remind the tourists to understand the destination's pandemic control policy and also keep your personally healthy during the travel process. Please wear your mask and reduce clustering and gathering and maintain social distancing and cope with the pandemic control policies so as to safeguard a healthy travel environment together. Thank you. Now we allow further question. Thank you. From China Daily. My question goes to the Ministry of Culture and Tourism. And what are the measures for supplying cultural and tourism products during the holiday? The floor is given to Mr. Li Xiaoying. Thank you for your interest in culture and tourism. We are still facing severe pandemic control situation within China. To do a better job in the holiday season, and we have sent out a circular and convened a telephone conference to make a deployment of the work during the pandemic heat season. And we will implement the following 4 requirements. First, we will strictly implement pandemic control measures. We require all cultural units, museums, and travel agencies to check the health code of the passengers and measure the temperature, and also remind all the passengers to wear their mask, improve ventilation, and encourage better disinfection. We also encourage the tourist place to have peak limit reservation requirements and staggered visits. And we also offer differentiated treatment to different areas. Second, we try to supply better product. We combine online and offline channels to provide more online travel services so as to reduce gathering we guide A-level tourist spots and A-level hotels and restaurants to improve their service quality. And libraries, cultural stations, museums will stop or temporarily reduce the number of cultural events. Thirdly, we have emergency measures. We guide cultural units, museums, and cultural organizations to have emergency drills to be prepared for emergencies. And the cultural and tourism agencies should work together with local health authority, public security authority, and Ministry of Information Technology. Once a pandemic hit the region, and they should work together with the local government to do epidemiology survey and to help arrange the tourists. Fourthly, we will have better communication and guidance, and we will have a health check to prevent loopholes in the pandemic control measures and guide the local culture and tourism units to follow the rules. And through media platform, we guided the public to wear their mask and keep their temperature measured and check their health code before they travel to any place. Thank you. Now we allow further questions. Thank you. From the paper. My question is about the vaccination program of China. What are the progress of vaccination for people above the age of 60? Now the floor is given to Mr. Wu Liangyong. Thank you for your question. According to the Joint Agency Prevention and Control of the State Council and National Health Commission, actively promote COVID-19 vaccination progress. By the end of April 27th, in total, we have provided 3,338,555,000 dosage of vaccines. The total number of people who have received vaccination reached 1,284,646,000, and with 1,249,413,000 finished full course primary series. And in total, the coverage was 91.12% and 88.26% for vaccination and full course vaccination. And booster dosage, 748,596,000, and sequential booster dosage inoculation reached 29,558,000 people, and 226,916,000 of elderly people above the age of 60 have received vaccination. Among this, 250 million and 37,000 have finished primary series. The coverage ratio was 85.94% and 81.44% respectively. And we have provided booster dosage to 159 million and 920,000 of those elderly people. And the vaccination progress is smooth, and booster dosage are carrying out smoothly, and inoculation for elderly people above the age of 60 are increasing on a remarkable basis. And last week was the World Immunization Week, and April 25th is the children's vaccination date. And we have made arrangement requiring localities to go to schools, villages, and elderly people's home to increase communication and enrich channels of communication, enhancing intergovernmental collaboration so as to help people to have objective and scientific understanding about the importance and the necessity of vaccination. We use scientific data and facts to prove that speeding up COVID-19 vaccination is an important channel to safeguard people's lives. I encourage media friends to have more communication and publicity about vaccination work. We work together to encourage more people, especially vulnerable people, elderly people, to increase their vaccination ratio. Thank you.
好，来请左侧区第4排，跨过到第2位记者。
谢谢主持人。每日经济。
Economic Daily.
每日经济新闻宏观频道记者提问：
In context of the current pandemic, how health institutions ensure the normal health needs of the general public can be met, especially during the May Day holiday? Madam Guo Yanhong is taking the question. Thank you for your question. The current pandemic in our country is featured by the interwoven sporadic outbreaks and cluster cases. The control situation is still grim and complicated. The health institutions in some localities have been negatively impacted by the pandemic to some extent. To ensure the daily and regular medical service need of the general public, in particular the treatment of acute or emergency or critical cases, have been our always concern and attention. The Health Commission, National Health Commission has provided detailed guidance to localities and urged localities to make holistic arrangements between pandemic control and the guarantee of normal and regular services for healthcare. With the upcoming May Day holiday, on one hand, we require health institutions to have the services to be on demand. We require health institutions to set up a requirement protocol for the duty service during the holidays, and there will be leaders of the hospital accountability system. In particular, 24 o'clock, around the clock, emergency services must be provided to the general public, and we do not allow the suspension or rejection of the needs of the general public for seeking medical services. We require health institutions to have an accountability system. Those hospitals or health institutions who firstly receive the patient will be accountable for the entire treatment process. Whatever reason shouldn't be the excuse for the rejection or delay of treatment, so that all those who need emergency services or regular services can have their needs satisfied timely. Besides, there must be buffer zone established in the emergency rooms or the rescue rooms or the theaters and wards. For those patients with the NAT testing results yet unknown in these buffer zones, health professionals with proper personal protection can provide timely treatment to these patients. For patients on hemodialysis or chemotherapy, pregnant women and neonatals, they must be provided with targeted and refined services so that the regular and continuous health services can be provided to them. Chronic patients who depend on long-term therapeutic treatment, we have allowed the prescription that can sustain for 12 weeks so as to maximize the dosages that can be provided to patients. For regions hit by the pandemic, there should be arrangements to ensure services can be guaranteed in the control regions and manage the regions. If any resident in a closed-down community needs to go to the hospital, then there will be door-to-door closed-loop services provided by the community. we also require scientific and targeted prevention and treatment of the COVID-19 among health institutions. COVID-19 prevention control cannot be the excuse for arbitrarily close down health institutions. And for the health institutions who do have to be put on lockdown measures, there must be emergency mechanism initiated so as to ensure continuity and coherence of services provided in emergency rooms, dialysis rooms, the surgery wards, and the ICUs, and the delivery rooms, so as to minimize the impact of COVID-19 prevention control on the regular health services in health institutions. By so doing, we can ensure guarantees can be provided to the acute and critical cases. Therapeutic drugs can be supplied to chronic patients, and all patients can have a normal access to medical services. With the Red Star News. At present, how is the progress of the flow of cargo? Are there any pre-deployment for the unfettered cargo flow during the May Day holiday? Mr. Zhou Ming is taking the question. Thank you for your question. This is a question of common concern by the general public and is very much in the limelight. On 18th of April, the National Tele-West Conference was held to promote a stable supply chain and smooth logistics. The Ministry of Transportation has been collaborating with other departments to act swiftly and focus on key questions to step up holistic arrangement and scheduling to ensure smooth and effective logistics. We've set up a working mechanism and a leadership work panel. We've set up mechanisms like daily rescheduling, information release, and coordination mechanism for individual cases. Provinces have set up corresponding working mechanism to implement all these measures. Second, we've refined and solidified our working measures. We've worked out passport management for the transportation vehicles carrying key supplies and a whitelist management for the cargo drivers. In 24 provinces, these passports can be used in a compatible manner. In 16 provinces, there are specific measures adopted to facilitate the unfettered logistic flow. Third, we've been focusing on some prominent issues. We've set up a list to facilitate the unfettered logistic flow. We've clarified the accountability of all involved parties and focused on the special rescheduling for the Yangtze River Delta, Zhujiang River Delta, Beijing, Tianjin, and Hebei provinces to focus on prominent questions and to follow through on our original plans. We have 7-day, 24-hour around-the-clock duty services. By so doing, we have solved the obstacles faced by the cargo drivers in 700 incidents. Fourth, we've set up an industry self-check to deal with the blocked service areas and the ports or wharves, including the navigation locks. As of now, the artery of transportation have been unblocked, and there has been orderly transportation along the ports and the navigation routes. As of 27th of April, the closed toll stations and service areas among all in the country was only 0.07%, 0.32%, respectively. That is to say, we have only closed 8 toll stations in the country and only closed 21 service areas across all the service areas in the country. Compared with the 18th of April, the cargo throughput on highway increased by 11.38%. The cargo transported via railway and highway increased 7.18%, 7.19% respectively. The throughput from the ports have been kept stable compared with the previous year. Fast courier business by post increased by 12.08%.
The fifth measure we adopt is to strengthen logistic support. We launched 3 emergency material transfer stations near Shanghai region so as to ensure the transportation of daily necessities. And for container truck, we have a closed loop management around the Shanghai port. As compared to April 18th, on April 25th, the number of container truck entering into Shanghai increased by 30.63%. The number of truck leaving Shanghai increased by 32%, and the daily throughput arrived at more than 100,000 containers each day. With concerted efforts, now we have basically eased the bottleneck in transportation. However, we still have problems in certain areas with increased traffic control measures in some of the localities. And during the holiday and afterwards, to ensure the supply of daily necessities in pandemic hit region, to ensure people's orderly life and production, Ministry of Transportation will continuously play the role of our working leadership working group to strengthen cross-agency coordination and guide localities to ensure the smooth operation of transportation backbone lines. And we deepen the mutual recognition of health code across the country, have one travel code only, and to avoid the use of local codes. And we will precisely manage the cargo truck and improve the travel efficiency, and so as to ensure people's daily necessities and production materials can be transported to their places. Now, we allow 2 final questions because of the time limit. From Southern Daily. Personal protection measures are very important for pandemic control. There are only 2 days before the May holiday. And what are your reminders to travelers? The floor is given to Mr. Li Xiaoyong from Ministry of Culture and Tourism. Thank you for your question. The May 1st holiday is coming. Ministry of Culture and Tourism reminds the travelers to keep pandemic control measures in heart, pay attention to security first. First, follow closely the pandemic situation, and you should not visit high and medium risk region. And the tourists should understand the destination's pandemic control policy, and also follow closely the reminders issued by tourism, public security, transportation, and weather agencies. And stagger your visits and reserve your tickets. And wear your mask, measure your temperature, and have your health code checked. Keep distance with other travelers, and also keep necessary drugs, and buy some travel insurance policy. Second, and for those travel areas reserved for certain travel tourists, and please keep your personal health safe. And for some travel projects which require age, health, and psychological condition requirements, and such as drifting, snorkeling, and deep dive, and please avoid danger, and you should avoid visiting those areas with a high risk of landslide, falling rocks, or mud rock flow, and flash floods, and other risks. And you should not bring any forbidden materials while you are taking public transportation vehicles, and avoid the hazards of fire. Thirdly, and please follow the rules during the visit. And when you order food, please order the food that you can eat. Avoid waste and protect the environment without throwing rubbish into the water, and don't get onto the grassland. Don't pick the flower, and protect the animals and protect the public goods. And these are the new habits that we should uphold. Now we allow the final question. Thank you, Chair. From Phoenix TV. Recently, State Council made a deployment about ensuring logistic support. And what are the requirements and measures adopted by the Ministry of Railway to ensure the smooth transportation of daily necessities? The floor is given to Mr. Zhu Wenzhong. Thank you for your question. Ministry of Railway and the Railway Corporation implement the State Council and Party Committee's requirements. We have adopted many measures to ensure the smooth transportation of thermal coal, petroleum, food, and fertilizers. We try to ensure the material transportation for key components and also the transportation of finished products so as to ensure food security, energy security, and supply chain, industrial chain stability. First, we increase traffic input, and also we try to mobilize more passenger and cargo capacity along main railway lines. Second, we optimize transportation organization, scientifically dispatch vehicles and human resources, and we give priorities to key materials, and we have fast uploading and offloading. Thirdly, we have better coordination with local governments and key components to understand the transport needs of pandemic PPEs and daily necessities and production materials, make arrangement of special lines on the railway, and increase the uploading and offloading capacity so as to get through the final mile. Fourthly, we strengthen international cooperation. We strengthen the transportation organization for China-Europe Railway and also other major railways like China Laos Railway so as to increase the transport throughput along the railway. And we also adopt pandemic prevention measures to ensure that the pandemic will not spread across the railway. And we have invited many experts to introduce you how can we prevent the spread of the virus during the May 1st holiday. And please keep yourself safe and avoid too many gatherings, and so as to ensure a healthy holiday. We will have a future press conference, and please stay tuned. Thank you. That's the end of today's press conference.
hao